Bird flu, pandemic, avian influenza. You've heard about it, read about it, seen it on TV.
So, how worried should I be?
What can I do to be prepared?
What is Virginia doing to prevent it?
Those are all good questions. And having the right answers can help us all be better prepared in case there is a flu outbreak. The Virginia Department of Health has developed this video to help you understand the pandemic issue and to help you prepare for any possibility should it arise. Right now, there's no need to panic. Virginia's public health officials are keeping a close eye on the situation, and we'll keep you informed of any developments. We're all working diligently to assure the health and safety of all the citizens of the Commonwealth. But government alone cannot protect you from a pandemic. Every Virginian needs to be prepared. That's why we've made this video, so you can learn important information about keeping yourself, your family, and your community safe. Thank you.
H5N1. That's the strain of the flu virus that's commonly called bird flu or avian influenza. By the end of 2005, the bird flu had sickened and killed birds in Asia and Europe and had also affected over 130 people in Asia. Fortunately, it is not easy to spread from person to person. But if that changes, it could set off a worldwide outbreak or pandemic. A pandemic could have widespread social and economic impacts. So, what can you do? The simple answer is to educate yourself and your family and stay informed. I'm sure you have plenty of questions, and we're going to try to answer them in the next few minutes.
What's the difference between influenza and flu?
Flu and influenza are the same thing. It's just that flu is a short little nickname that we've given to the disease that's called influenza. Influenza comes around every year. Here in Virginia, we expect to see it any time between November and March. And each year there are over 200,000 hospitalizations and 36,000 deaths caused by influenza in the United States.
¿Qué es exactamente la influenza?
Influenza is a serious disease. It makes you feel really sick, and it's a disease that makes you feel like you just can't get out of bed. The symptoms are a fever, and with the fever you'll have a cough, a sore throat, body aches, muscle aches, and really feel tired. And some people can develop a more severe form of the disease and have to go to the hospital for pneumonia.
So tell me, how do you catch it?
You catch the flu by breathing in droplets that come out when someone with the disease coughs or sneezes. There are different strains of the flu virus, and once you've caught a particular strain, you can't get sick from that strain again, but you can get sick from a new strain.
What's meant by new strains?
The flu virus changes forms from year to year. It can change a little bit or it can change a lot. When it changes a lot, it means there's a new strain out there that's never been seen before, and no one's immune, and that can lead to a pandemic.
What exactly do you mean by pandemic?
A pandemic is a worldwide epidemic. You can have a pandemic of any disease, but what we're talking about here is a pandemic of influenza.
That brings us to the bird flu, also known as avian influenza. In late 2003, Asian countries started seeing large numbers of chickens and other birds dying of a severe flu-like illness. More recently, new cases have been reported in many parts of Asia and parts of Europe. At first, this new strain of flu was only seen in birds. Then, a few humans living and working in close contact with these birds caught it. So far, half of those people who have contracted the bird flu have died from it. This has caused scientists to be concerned about its potential impact if it does develop into a pandemic. The good news is that it doesn't spread easily from person to person, which would be required for a pandemic to begin.
Is it safe to eat chicken?
Yes, definitely. There is no indication that bird flu can be spread through properly cooked poultry or eggs.
So, if it doesn't spread easily to humans, why are we concerned?
We're concerned about the current situation because it meets 2 of the 3 criteria that are necessary for a pandemic to occur. One is that we have a new strain of the flu virus that's never been seen before, and 2 is that this strain of the virus is causing severe illness and death. We're fortunate that the 3rd criterion is missing, and that is that this strain of the flu virus is not easy to spread from person to person. But flu viruses are good at changing, and if the bird flu virus changes to a form that's easier to spread from person to person, then we're concerned that that could lead to a pandemic.
It's important to remember there is no certainty that this bird flu will become a pandemic. Even if a pandemic does not develop from this strain, scientists believe that it is not a question of if we will have a pandemic, but when. That is why so much attention is being placed on getting prepared, just like you would if you knew a hurricane was coming.
¿Cuándo fue la última vez que se produjo una pandemia?
There were 3 pandemics in the 20th century. The last truly devastating pandemic was in 1918. Between 20 and 40 million people around the world died. And unlike the seasonal flu, the 1918 Spanish flu pandemic targeted healthy adults in their 20s and 30s.
If a pandemic occurred, it would have a great impact on our society. We'd all see a lot of people getting sick and dying, and it would have a big impact on our country's economy, on businesses, travel, and certainly on the healthcare system itself.
No one could say for sure how many people would get sick and die, but any pandemic could cause severe damage to our country. In Virginia, the predictions are just as serious.
Are there flu shots for the bird flu?
This year's vaccine does not protect against the avian flu. Each year, scientists develop a vaccine based on the influenza strains expected to be circulating during the upcoming flu season. It takes an extremely long time, at least several months, to produce a vaccine. So actually, we're not going to be able to rely on a vaccine to protect us from a pandemic during the early months.
Well, what about medicines, like Tamiflu?
Tamiflu will not cure influenza. It will, if taken early enough in the infection, reduce symptoms up to as long as 1 day. But quite frankly, there won't be enough Tamiflu for everyone during a pandemic.
So, should I go get some Tamiflu for my family?
VDH agrees with the CDC. Individuals should not stockpile Tamiflu. The supply is very limited. Even if we could purchase mass quantities, manufacturers can't manufacture enough to protect large segments of the population.
If there's not enough vaccine or medicine to go around, who gets it first?
Deciding who will receive the limited supply of vaccine or medications is one of the most difficult decisions to be made. The Virginia Department of Health will follow federal recommendations. These focus on protecting healthcare workers who provide direct patient care, as well as people at highest risk of complications and death. We also want to assure that we can maintain public safety and essential services.
I'm pretty healthy and I'm relatively young, so I'm probably pretty far down that list. What can I do to keep me and my family healthy?
There are a few easy steps that can help keep a virus from spreading. Wash your hands regularly and carry hand sanitizers to use when soap and water are not available. Cover your mouth when coughing or sneezing. Avoid touching your eyes, nose, and mouth, and stay at home when you are sick. Also, keep sick children home from school and daycare. These steps can significantly reduce the spread of illness.
The most important action an employer can take to prevent the spread of infectious disease in the workplace is to encourage employees to stay home when ill.
¿Y si uso una máscara, me ayudará?
Personal protective equipment is used by healthcare professionals in the direct care of sick individuals. The Centers for Disease Control and Prevention and the Virginia Department of Health don't recommend the use of masks in the general community. Schools, businesses, offices, and communities should instruct students and employees to stay home if they are sick. The good habits I just mentioned are more effective means of combating flu.
Could businesses actually be shut down?
Businesses could be forced to shut temporarily because too many workers are out sick. Business will also feel the effect of fewer people out shopping or doing their usual activities. During a pandemic, public health officials will look at ways to slow the spread of infection. For example, limiting large gatherings such as concerts and sporting events, encouraging telecommuting, closures or snow days put into effect, or possibly closing schools.
Could people actually be quarantined?
Isolation and quarantine might be used during early stages to try to control the spread of infection. Keep in mind that isolation means separating people who are ill from those who are not, and this is a good idea in any case. Quarantine, however, means separating people who are not yet ill but have been exposed to the virus. Once there is widespread infection, quarantine would probably not be effective and would not be used.
What has the government been doing to prepare?
In 2005, the United States Department of Health and Human Services and President George W. Bush issued a federal plan to prepare for and respond to pandemic influenza. The nationwide strategies will be woven into our local, regional, and state response efforts. This will help assure that government, public, and private responders will have consistent guidance in dealing with a pandemic. The federal plan does not contain answers to all of the difficult questions that will face local communities, which is why states and communities need to enhance their own efforts.
So, what's Virginia doing right now to prepare?
Keep in mind, we don't know for sure when a pandemic may strike. Although public concerns about pandemic flu came to light in 2005, public health officials have been planning for pandemic flu for many years. The Virginia Department of Health developed its first plan in 2002, and we've continually updated our plan as we gain more information.
In early 2005, the Virginia Department of Health created the Pandemic Flu Advisory Committee. This group includes representatives from public health, the healthcare and mental health community, state and local government, law enforcement, first responders, legal advisors, ethics experts, faith-based programs, community leaders, university experts, utilities, schools, and businesses. They meet regularly to discuss the issues and revise our response plan. VDH is also working to get the word out through meetings with community groups and through public messages like this video. We believe preparedness rests not only on the shoulders of government, but also on all residents. It's been many decades since we've seen the devastating impact an infectious disease can have on society. We need to realize that this type of event can still occur.
¿Dónde puedo encontrar más información?
You can visit the Virginia Department of Health website or the Federal Pandemic Flu site. Remember, at this point, there is no pandemic. There's no reason to be alarmed, but there are many reasons to educate yourself and get prepared. We want to help you understand the situation and get the facts straight. The Virginia Department of Health will continue to provide important information to newspapers, radio, and TV as soon as it's available. We will regularly update our website and print materials to provide you with the latest information. The best thing you can do to protect yourself is to learn as much as you can and plan for threats in your area. We're here to help. If you have any questions, please contact your local health department or the VDH Pandemic Flu Information Center. Until then, the Virginia Department of Health reminds you to stay informed, stay safe, and stay healthy.